like to thank my panel members for being here and being the great support for Merck More Than a Mother campaign. And a lot of you might ask, what is Merck More Than a Mother campaign? It is an initiative being introduced to first Africa and now in Asia to empower infertile women through access to information, health, change of mindset, and economic empowerment. As we all might know that in many cultures in Africa and developing countries, infertile women, women who couldn't have children, they always subject for discrimination, ostracization, stigmatized, and also most of the cases subject to physical and psychological violence. And you might even not believe or imagine that this could happen in the 21st century, but still it's happening in rural areas and many of the areas, and that's why we are all here to make a change, to change the culture, to empower these women, to also build capacity in fertility care, because you know that some countries till now, they don't have even one fertility specialist. So we are training there the first fertility specialist in these countries, like Sierra Leone, like Liberia, like Guinea, Gambia. But these are countries we are making history there through Merck Foundation, which is the foundation who initiated this campaign, and the foundation which is a philanthropic arm of Merck. I will start with the first country we launched the Merck More Than a Mother campaign in, which is Uganda. Honorable Minister Sarah Opendi, the Minister of State of Health, and how with her dynamic and passion towards the cause made a change in Uganda with thousands of women we empowered through also Merck More Than a Mother, and also the training and the first IVF in public sector in Uganda.
I must really say that although infertility has existed for a very long time, our government, the government of Uganda, just like most governments in Africa, have not paid attention to issues around infertility. And it had not even occurred to me that this was a big problem until I got involved in this campaign. So I want to appreciate that through this effort, we started the campaign, we broke the silence, we have been speaking, and for the very first time, the government of Uganda, although we are constructing a 455 state-of-the-art women's hospital, we had not thought much about talking about issues around fertility. And this hospital will be the first public facility that will be offering the IVF services and fertility care services in the country.
In Namibia, you have like 32% of people who are infertile. It's like 1/3 of the couples. And this is just on couples. It's not on young people who should have early detection and have prevention. So in order to strike the balance, we are going to bring women from all 14 regions of the country and men, and they are going to come together with members of parliament who are making the laws. We have to shape our communities and shape them in making use of the medical provisions which are there, and how we as leaders can take part in changing, not also just looking at the negative, but how we can positively change.
When we started in Sierra Leone, we thought it was just stigmatization about women not having children, but it's also about women having just girl children. Men keep marrying 2, 3 wives because the first wife can only produce girls, not realizing that we as women are really not responsible for the sex of a child. That's another stigmatization. We're building a new hospital. We've already provided the space for the IVF clinic. We are training the women in the rural areas on cleanliness, genital cleanliness. And as far as I'm concerned, it's all part of what Merck More Than a Mother is talking about.
Infertility is a public health challenge in Zambia, and it's understated. If you look at the statistics, you hear of 1.1 to 2% of women being infertile or the population being infertile, but 10 to 15% of all outpatient attendances in our gynae clinics is about infertility. So this is a huge problem. Now, to aggravate the problem, we do not have adequate infrastructure and equipment and human capital to actually investigate and diagnose infertility. The way forward is ensuring that our universal health coverage agenda includes health system strengthening to cover all the variables that will include addressing infertility. We must invest in the human capital required to manage infertility. Now, women deserve more respect than being the culprits whenever there is an issue of infertility.
Et le Girafe a fait beaucoup d'études sur l'infertilité en Afrique et ça a été publié dans le journal Hormones et Reproduction en 2013. Nous avons fait aussi des études sur l'infertilité masculine, ce qui nous a permis que les hommes aujourd'hui viennent consulter avec les épouses parce qu'ils ont pris conscience que l'infertilité du couple est un problème de l'homme et de la femme. Notre collaboration avec Merck a commencé en 2015. La session Excellence académique, qui est la mise au point sur les nouvelles technologies en infertilité. Il y a aussi la formation des formateurs. Aujourd'hui, il y a Merck Foundation qui nous aide, la formation des embryologistes et des cliniciens, près de 30 personnes qui doivent être formées sur l'infertilité et l'AMP.
All of us as healthcare providers get into this field because we want to help people. We see individuals who have benefited from the fact that the victims of infertility have been helped. They have not forgotten. You could not leave them out in good faith and move forward with the advances that we're talking about at a scientific level. Merck More Than a Mother program has also realized that we need to provide sustaining healthcare facilities to access. So I think we've turned the corner, Rasha, and fellow politicians around the room, around the table. I admire what you're doing. The world admires what you're doing. Let's keep it up.
The ignorance of our people in Africa is such that when people are infertile, they don't want to talk about it because they think it's a personal matter. It is not peculiar to Africa. It is all over the world. So I thank Merck Foundation for giving this opportunity and for even now going into the social information to inform people about preventing infertility and also saying that womanhood is greater than motherhood. In other words, it doesn't matter. A woman can still achieve many things even without a baby. Thank you.